professor in the Department of Community Health Sciences at Southern Miss. She's a double graduate from Southern Miss, meaning she has a Bachelor's of Science in Biology from 1998 and an MPH in Health Administration and Policy in 2000. She earned her doctoral degree at the University of Alabama at Birmingham, which is part of our conference at Southern Miss, the Conference USA, which will soon have a new name, which is going to be exciting. I always like to throw sports trivia in like that. From UAB in Health Education and Health Promotion, with a doctoral degree in 2004. Before joining faculty at Southern Miss in 2004, she worked with Deep South Network for Cancer Control and the American Cancer Society in Birmingham, Alabama, and Hattiesburg. Also, since founding the organization in 2005, Dr. Anderson Lewis has served as the Executive Director for My Mother's Heart Foundation, Incorporated in Hattiesburg. She teaches research and is primarily focused on community-based participatory research, which is a big focus of the College of Health. Not bench research, but community-based participatory, which gets bench research out into the community and tests it. That's a big thing that we focus on. The research has included health disparities research, or issues, cancer prevention and control, cardiovascular health, religion and spirituality and health, curriculum development, curriculum capacity building, evaluating community capacity, training community health advisors, and the use of community-based research principles to design, implement, and evaluate community health advisor, lay health worker interventions. That's a mouthful. She has expertise in conducting focus group sessions, community building and organizing, conducting community assessments, program development, program planning, program implementation, program evaluations, working with diverse populations affected by health disparities. She's a member of the Public Health Association, the Society for Public Health Education, the Mississippi Public Health Association, and the Center for Black Studies Advisory Board, where she was a founding member. You can tell she has a lot of extra time on her hands, along with her family she was talking about earlier. She's received numerous awards. I'll let you read those because there are quite a few of them, many in the College of Health, and the one that I like the most, or the two I like the most, the Top 20 Under 40 by HQ Hattiesburg Magazine, and the Sister Saving Hearts Award from Cheerios and the Congressional Black Caucus in 2008. So she's a great speaker, as you can tell. So I'm not going to talk anymore. I'm going to get her PowerPoint loaded up, and please welcome Dr. Anderson Lewis.
How are you guys doing tonight?
Fine, how are you?
First, I want to thank Ron for that presentation, and whoever made this bio for me, can you please send me a copy?
Yeah.
So I can use it again, and I would have just said, hey, you guys just look at this. I wouldn't have read all of that, but thank you for reading that information, Ryan. So, my task tonight for the next, I think, 20 minutes, Ryan, you're going to let me know when my 20 minutes is up? It's 20 minutes, right?
Yes.
About 20? Okay. So I'll try to keep it as brief as possible. As Ryan said, the task is to talk about poverty and its impacts on health, causation, and correlations. That is really difficult to do. I am a health educator by trade. When you start talking about correlation and causation, and I assume this is why they had a difficult time finding a speaker for this, you have to come from an epidemiology standpoint to really get to the meat of what's going on. So again, for this, I'm going to come from a health education standpoint to kind of scrape the foundation of what's going on. So how many of you guys have kids? I know you have kids over there. Raise your hand one more time. Kids have a lot of questions. If you don't have kids, you at least probably have nieces, nephews, or at some point you're around kids or somebody has forced you to keep their kids. So they have a lot of questions. It's always why, no matter what you say to them. So I'm going to start with this little story, and it kind of reminds me of my daughter because when I say something to her, it's always why. So the story is, it's Jason's story. Why is Jason in the hospital? Because he had a bad infection in his leg. But why does he have a bad infection in his leg? Because he has a cut on his leg and it is infected. But why does he have a cut on his leg? Because he was playing in the junkyard next to his apartment building and he fell on some sharp, jagged steel. But why was he playing in the junkyard? Sounds like my daughter. Because this neighborhood is kind of run down. A lot of kids play there and they have no one there to supervise them. But why does he live in that neighborhood? Because his parents can't afford a nicer place. But why can't his parents afford a nicer place? Because his dad is unemployed and his mom is sick. But why is his dad unemployed? Because he doesn't have much education and he can't find a job. but why? And this could go on and on and on. So again, if you have kids, you hear this, why that. So if you think about people who possibly could be in your family or that you see out in the community who possibly may have things like diabetes or heart disease or some other health issue or condition, sometimes you want to know why. You know, why does this person have diabetes? Why is this person obese? Somebody may be obese, not because, you know, they eat a lot. There may be so many other reasons. Think about what's in their neighborhood. They may not have the proper places to get food in their neighborhood. On the corner, they may have a Taco Bell, McDonald's, churches, Popeyes, all of the things that are not healthy for us. There may not be a Subway in that community. There may not be a good place for them to walk or ride bikes. It may be a high crime area. So it may not be just because that person likes to eat Oreos, Doritos, and a lot of times when we see somebody who's obese, we just want to go directly to say, hey, they don't care about themselves and they just eat too much. But again, you have to think about their environment that they live in. So I don't know how much you guys know about poverty and the levels, the guidelines for poverty. So for a family of 4, how much money, and this is for anybody, how much money do you think you would have to make to be considered a person or family who's in poverty? Family of 4.
27,000.
Close. 23,000. So 4 people living on 23,000 in a year, not a lot of money. Not at all. For a family of 8, what do you think the number is? You wish it was 50.
No.
No, it should be 46. 38,000. 8 people. So any of you with a big family, if you have 5, 6, 7, or 8 people, you can't do much with that amount of money. So think about that and how people are living in the situations they are in with poverty. So what links poverty and poor health? Poverty is both a cause and a consequence of poor health. Poverty increases the chances of poor health, and poor health in turn traps community in poverty, just as Ryan was talking about. So, I just wanted to give you a quick update of some things. This is from the U.S. Census Bureau for 2010. Some quick things about poverty in the U.S. and what's going on with us. The official poverty rate for 2010 was 15.1%, up from 14.3% in 2009. This was the 3rd consecutive annual increase in poverty rates. Since 2007, the poverty rates have increased 2.6%, 2.6 percentage points from 12.5% to 15.1%. What do you think is going to happen, what the numbers are going to read for 2011, 12, and 13? What's going to happen with these numbers? Increase? Possible increase. You know, a lot of people are unemployed right now. Things aren't getting as good as we would like them to get. So these numbers are increasing. The official numbers have not come out, of course, for 2011, but the numbers have increased a little bit. So in 2010, 46.2 million people were in poverty. That's a lot of people. Up from 43.6 million in 2009, the 4th consecutive annual increase in the number of people in poverty. And then the last little tidbit of information I want to give you from the U.S. Census from 2010 was the number of people in poverty in 2010, is 46.2 again, is the largest number in 52 years for poverty. So, again, these numbers are increasing, and this has been the largest number in 2010 in 52 years. All right, so I'm going to go through and tell you guys 10 things you need to know about health and how these things are related to poverty. These 10 things are adapted from a documentary that I show my students. It's over 4 hours long. I wish I could have shown you guys the documentary, but I only have about 18 minutes left. So definitely couldn't show you a documentary. So these things are adapted from, if you get a chance, you can pull this up. It's Unnatural Causes is Inequity Making Us Sick. Has anybody ever heard of this? It's a PBS special. Really good video to watch. Are inequities making us sick? Easy question to answer. Yes, they are. So the first thing, health is more than just health care. Doctors treat us when we're ill, but what makes us healthy or sick in the first place? So a lot of times we need to think about that. Why are you even going to the hospital? Why are you going to the emergency room? What got you there? Research shows that social conditions, the job we have, some of us work jobs that are very stressful, low money. So the jobs you have, the money you get, which may or may not be a lot, the schools we attend. You think about some of the schools in Mississippi and where Mississippi falls for education, not that good for some people. So the education you get, it could mean a lot for your health also. Why is education, why would that mean anything for your health, the education you get? Knowledge of, just general knowledge?
Healthy lifestyles.
Of healthy lifestyles. So what else? Education, what is?
I'm going to say the buildings that you're in too. If you're in a poor school district, you're going to be in a building that may not be in the best shape.
Okay, that's true. So it's the building you're in, the environment. So knowledge, the building. What else with education? So poor education, how does that affect your health?
How does it affect? Sometimes it's technology or the standards for the type of education you receive.
Technology is the standards for the type of education you receive.
Technology are the standards of education.
Okay, the standards of education.
Yes.
Okay, someone else. How does
Your future salary and how much you'll make and what kind of a job you'll have, so that affects the kind of health insurance you'll have.
Okay, so your future salary. So if you're just looking at kids who are in elementary school and if they're not doing well and they're not reading well, a lot of times these kids may not ever make it to college. They may not ever graduate from high school, so it's going to affect their salary for one thing. And then if they have a low literacy level, knowledge, even if they go to the doctors, they may not be able to read the prescription that they have or the pamphlet that the health educator may give them. They may not even be able to read that information. So education plays a huge part in this. There's actually a study out that shows that individuals in the 3rd and 4th graders, researchers look at these 3rd and 4th graders, they look at their reading level. And from their reading level, they predict how many prisons they're going to build in the future. 3rd and 4th graders. It costs a lot of money to keep somebody in prison for a whole year. And we're looking at our 3rd and 4th graders to see what their reading level is to determine how many prisons we're going to build in the future for these kids. Because if they have low literacy level, we may think that they're going to do some type of crime and they're going to end up in prison. Not a good way for us to think. Take that money that you're possibly going to use to hold them in prison and do what?
Teach them to read.
Teach them to read. Sounds simple, doesn't it? Why would you spend that money on the study of 3rd and 4th graders? Teach them to read. More teachers, better teachers, tutoring, more programs. We spend thousands again on these individuals in prison. So again, the schools, the neighborhoods we live in, again, the neighborhoods that may be high crime, may not have fresh fruits and vegetables, you may not have the best grocery stores. These things are as important as our genes or our behavior. So, number 2. I know there are a lot of students in here. I want you guys to look at this slide. Don't use me as an example. When you make slides, don't put this many words on the slide. Just wanted to give you a heads up about that. So I did this because I'm trying to take this more than 4-hour documentary and put it in a couple slides for you. So, health is tied to the distribution of resources. Really important. So the single strongest predictor of our health is our position or in a class pyramid. Whether measured in income, schooling, or occupation, those at the top have the most power and resources, and those who are at the bottom, they don't have the resources that they need. They may not have health insurance, or they may have insufficient health insurance. They may not have, again, good schooling. They may live in an area where they don't have hospitals, they don't have clinics. One of my students actually told me they lived in the Delta of Mississippi, and they have an emergency room there, and when they go to the emergency room, sometimes there's a sign on the door that says, "We'll be back in 2 hours." That is not good access to care. Emergency room, we'll be back in 2 hours, not good access to care. So think about those things. If you live here in this area, and I assume most of you do live down in this area, you probably, can easily go to a clinic or go to a hospital. But some people who are in more rural parts of Mississippi, it's not as easy for them to be able to go to these places to get the care that they need. So poverty plays a big part in what your health looks like. So number 3, racism imposes an added health burden. Past and present discrimination in housing, jobs, education means that today's people of color are more likely to be in the lower class ladder. So looking at the past historically, individuals like African Americans and American Indians, there's a lot of trust that's been lost in the healthcare system. These individuals are the individuals we see who may not have the best jobs, may not have the best education, again, because of where they live and some other things that may come into place to cause them to be in a situation where they're in poverty. So, but even at the same level, African Americans typically have worse health and die sooner than their white counterparts. So you may have an African American and then someone who's Caucasian. They're at the same level, same job, and it may not be a good job, but they work at the same place. Same family situation, same education, but for some reason, people of color are dying earlier and have worse outcomes than their counterparts. Let's see. I know we have about 10 minutes now. Number 4, the choices we make are shaped by the choices we have. So individuals' behavior, whether it's smoking, diet, drinking, or exercise, do matter for their health. But making good choices isn't just about self-discipline. Some neighborhoods, again, you don't have the places where you can make good choices. You know, if you have a liquor store on the corner, if there's not affordable housing, if you're making your groceries at the convenience store, you know, some people actually go to the convenience store to get their groceries because there's not a grocery store around them. So, you know, they are forced to make those decisions. And if you go to the convenience store to buy most things, they're going to be much higher than they would be at a grocery store. And you're not going to be able to pick bananas and apples and grapes and those kinds of things. So again, you're living in a neighborhood where those resources are not there for you. Number 5, high demand, low control, chronic stress. How many of you guys are stressed? I think most of your students, it's the end of the semester. That's all. There's not many people who are stressed here. Stress really affects your health. And if you're somebody who's in a situation of poverty, they're stressed all the time. They're thinking about how they're going to pay their bills, how they're going to take care of their kids, what school their kids are going to go to, if the school is a good school, if their kids, you know, they may be able to be okay at the school some days, but other days there are bullies at the school, or there's crime at the school, or some kid may bring a gun to the school, or there's so many things, you know, am I going to lose my job? Am I going to be able to keep my job? I need insurance at my job. So there's so many things that could stress an individual out. So we have high levels of stress. Not to say that we all don't have stress, because it's not the CEOs who are dying of heart attacks, it's their subordinates. A lot of times if you're a CEO or if you're somebody who's on the upper part of the ladder, you may have a high-stress job, high-stress situation, you know, you have to take care of your family. But if you have money, you can at least take a vacation. You can go for a massage. You may even stay in a neighborhood where you can go for a walk every morning. But if you live in a situation that's a poor situation, you can't go for a massage. You can never take a vacation. And you can't go for a walk every morning. Chronic stress is deadly or can be deadly. Exposure to fear and uncertainty triggers a stress response. Our bodies go on alert. The heart beats faster, the blood pressure rises, glucose floods the bloodstream. All of these things threaten your health. But when threats are constant and unrelenting, these things never return to normal. So when your stress level is up at all times, it's like an engine that's being gunned, and you never stop and you never stop. So if I'm in a situation where I can't control any of these things because I don't have the money, again, don't have the education, don't have the environment that I need, my stress level stays up. And again, that's going to affect what my health is like. Number 7, inequality, economics, and politics, bad for your health. The United States, by far, the most inequality in the industrialized world and the worst for health. The top 1% now own more wealth than the bottom 90% combined. Doesn't make much sense. Tax breaks for the rich, deregulations, the decline of union, racism, segregation, outsourcing, globalization, and cuts in social programs destabilize communities and channel wealth to a small few. Power and health to a few at the expense of many people. Economic inequalities in the U.S. is now greater than it has been since the 1920s. So again, when you don't have the equality you need for people who are poor, those who are in rural areas, they're not going to be decent people. Social policy and health policy. Average U.S. life expectancy increased 30 years during the 20th century. Researchers attribute much of that increase not to drugs or medical technology, but to social reform. For example, improved wages and work standards, sanitation, universal school and civil rights. Social measures like living wages, jobs, paid sick time, family leave, guaranteed vacation, universal free schools, and access to college and guaranteed health care can further extend our lives by improving them. So I wanted to mention these things. The things I mentioned, social measures like living wages. So, you know, we have minimum wage here, but for a lot of people, minimum wage is not cutting it. You need living wages, things that are going to put you in a situation where you can actually live the life that you need to live. Paid sick and family leave for those who are in poverty. They're working a job. It may be a day-to-day job. It may be in a factory. If it's not a job where they get paid sick leave, guess what? If they're sick, they're going to work. It's not good to go to work when you're sick. You're just going to make that situation worse. So if you don't have the ability to take off, you're just going to continue to wear your body down. Guaranteed vacation. Again, not everybody has guaranteed vacation depending on what your job is. Universal preschool and access to college. There are some countries where they pay for college for everybody there. If you're able to go to college, they pay for it. So again, think about the stresses you have paying for college, the stresses your kids are going to have paying for college. Health inequities are neither natural or inevitable. Inequities in health arising from racial, class, and basic inequities are a result of decisions that we have made as a society. Thus, we can make those things different because we've made our society the way it is. Other industrialized nations already have in two important ways. They make sure that there are less inequality. In Sweden, for example, relative child poverty rate is 4% compared to what we have here in the U.S., which is 21%. They enact policies that protect people from health threats regardless of their resources. For example, good schools and health care are available to everyone. Here in the U.S., most of the time, if you're poor, of course, you can't send your kid to a private school where they have a good education, which could possibly affect their health in the long run. Again, the buildings that they're in may affect their health in the long run. They may be in a building where hopefully at this point most of our buildings have had the lead removed, but some of our homes still have those. But they may be in a place that's just not conducive to living and also their health. Number 10, we all pay the price for poor health. So you may not be in a situation where poverty is affecting you directly, but in some form or fashion it is affecting you. So it's not only the poor, but also the middle class whose health is suffering. We also spend $2 trillion a year to patch up our bodies, more than twice per person the average of what other industrialized nations are paying. Excuse me. And our healthcare system is strained to the breaking point. The U.S. lags behind 28 other countries. You know, we think we're first for everything that's good, but we lag behind 28 other countries in life expectancy, 29 other countries in infant mortality, and each year lose more than $1 trillion in work productivity due to chronic diseases. And for the most part, this is for individuals who are in situations of poverty. So, it would seem that addressing poverty in order to prevent negative health outcomes would be at the top of our list for public health. But guess what? It's not. A lot of times we concentrate more on specific things, which we still need to do, but we concentrate more on like reducing cancer rates, reducing obesity, reducing diabetes. Of course we need to do all of those things, but poverty could be that underlying cause for a lot of those things. It could actually cause diabetes, cancer, and heart disease. So we need to also make poverty a top issue when we're looking at health care and public health. As good health is crucial to protect the family from poverty, so better health is central to poverty reduction. Improving the health of the poor must become a priority, not only for public health, but also for other sectors of development, including economic, environment, and social. So here in the U.S., There are things that we need to look at. Our healthcare system is not where it needs to be. And there are several other reasons besides poverty. I teach health disparities on the Hattiesburg campus, so I also talk about a lot of other things like access to care, and there are a lot of cultural issues that affect what we're seeing in our healthcare system. But poverty is one of those factors that's the underlying cause for what we're seeing in our healthcare system. So this is a quote that I wanted to share with you guys. Anyone who has struggled with poverty knows how extremely expensive it is to be poor. Being poor is not cheap at all. So if you're poor, you're paying more for your medication. When you go to the hospital, you're paying more for that because you don't have insurance. And most of the time, you're not getting the preventive care that you need. You're going on the other end, you're getting the tertiary care that you need. So you're getting rehab, you're going to surgery, that type of thing. When if you would have gotten the preventive care, if you would have got some screenings done early on, you know, you would have prevented the surgeries on the back end. So again, being poor is not a cheap thing. So as I conclude this, I want you guys to think about these things. If you're anything like me, your mind is just running all the time. I think about things while I'm asleep, while I'm in the shower, while I'm eating breakfast. So, and I'm thinking about these types of questions. So I want to leave these questions for you guys to think about. Do conditions in your community promote or hinder your health choices? So think about where you live, what community you're in, what's there for you to eat, what's there for you to do recreational-wise. You know, can you get up and go walking in the morning? Is there a gym that you can go to? Is there a liquor store on every corner? So think about your community, and then think about someone else's community. So you may be in a community where those things are available for you, but one of your friends or one of your family members, think about the community that they're in and what's available to them. What health benefits might derive from affordable, quality, and secure housing? So what does secure housing or affordable housing has to do with health? Somebody quick. Less stress. What else? Affordable housing or secure housing. What does that have to do with health? Nobody can think?
That's what I'm gonna ask you. You're referring to secure housing as living in a safe, you feel
Being
secure,
able to, being secure, being able to have housing and having housing that's affordable.
I mean, if you can afford a house, and you can probably either, you know, afford to have a gym membership, or in other words, feel secure in your neighborhood to be able to go walking and exercising, depending on how you're doing it.
Anyone else?
If they have a house, they would be able to like work in their garden and stuff. That would allow them to at least be active.
Okay.
Affordable housing frees up money to spend in other areas like fresh produce or whatever other.
Okay. Anyone else?
Lowers the stress level.
Lowers the stress level. Anyone else?
No lead levels, because you're in a safe environment.
Okay. So you can be in control of the lead levels there. What else? Anything else? So in thinking about housing, there are research studies that are out that show that individuals who own their own homes have better health outcomes. For all of those reasons that you guys mentioned, you know, less stress, depending on where you are, you know, it's less crime, it frees up money for other things. It's more of a social, a cohesive social network with the family. So affordable housing really means a lot for individuals. Imagine staying in an apartment complex where it's noisy. Noise is a big thing that deals with health also, where it's noisy and there's crime and you're not sure what your neighbor's going to do today or what they're going to do tomorrow. So something that some of us may think is really simple, but housing and being able to afford housing, and you know, if you're in poverty, there's no way that you can afford a house. You're hoping you can pay your rent for month to month to stay where you're staying. So affordable housing is important. And the last thing I want you to think about tonight while you're taking your shower, what kinds of economic policies might reduce health inequities for the poor and improve the overall health of most Americans? All right, I tried to go through that really quick. Do you want me to question?